I'm joined this morning by Chris Walker, Emergency Preparedness Coordinator for the Hamilton County Health Department. Good morning, sir.
Morning, ma'am.
All right, bring us up to speed. We've seen these numbers. They've gone up, they've gone down. Where are we at right now?
Yeah, so we did see some initial surging after the holiday of cases. One day, I believe it was the second, we had up to 498 cases in one day, which is a new record for us. We have seen some drop in the numbers over the last few days, but I think that's mostly that testing dropped over the holiday, and we'll probably see those numbers start to go back up.
So Dr. Anthony Fauci yesterday said that we haven't even seen the precipice yet from what we expect to be the surge from Thanksgiving. When do you think we might see that?
Well, it takes 2 to 14 days from infection to start seeing signs and symptoms. And we're just out through the first week since Thanksgiving. There's a good chance that this week is not going to be a pleasant week for us.
What about testing? Obviously, if it's not going to be a pleasant week, we'll probably have more people being tested. How are they doing in terms of turning those tests around?
So the state's done a great job. Right before the holiday, there was such a high demand that the testing had creeped up to 5 days and sometimes a little bit more than that. They've got it back down to where they're getting results to folks in about 72 hours again. So it's taken a lot of hard work on their part. And we at the local level appreciate those efforts from them to get that back down.
Yeah, it's worth mentioning too that the OptumServe location there at Ivy Tech in Noblesville is now open on Saturdays and Sundays. So there is a way to get tested on the weekends.
That's correct. And we still have Saturday hours at Trinity Free Clinic in Carmel as well.
Fantastic. How are the hospitals hanging in there?
They're busy. It's a rough time of year for them as is, with flu season and general cold and flu-like symptoms and other injuries going on, things like that. And this has just compounded that issue. Most of the ICUs are at capacity or very near at capacity. Hospital beds are running around 50 to 55% occupied in the county. So they're having a rough go, and that doesn't take into account the fact that they have their own staff that have to isolate or quarantine depending upon whether they're sick with COVID or have been exposed and need to quarantine themselves.
Bring us up to date on preparation for vaccine delivery. Where are we at? What are we expecting to see? Who's going to get it first?
Sure. So we expect to see phase 1A, which is healthcare providers starting to receive vaccines toward the later part of the middle of the month, so within the next 2 weeks or so. Those plans are already in place. We do have 3 phase 1A hospitals in the county, and they're also looking at working with long-term care facilities. There's also a partnership between Walgreens and CVS to help vaccinate those folks as well. So we're hoping that the supply of vaccine meets the demand here in the county, and we can move through phase 1A quickly. We're also working on phase 1B, which is the target group of that still fluctuates day to day, so it's kind of hard to zero in on that one.
Anything other thoughts into the rest of this week?
We can't stress enough that we're looking at the fallout of Thanksgiving holiday this week, last week, and this week, and we're quickly approaching Christmas and the other end of year holidays. And you need to take a long, hard look at what your family has planned and potentially seek out some alternatives to limit the spread of COVID within your family.
Good thoughts. Chris Walker, Emergency Preparedness Coordinator with the Hamilton County Health Department. Thank you. We'll check in with you next week.
Thank you, ma'am.